Hello, everyone. Welcome to Breaking the Stigma with Rocco Spear. Today's episode will be Stigma with special guest Laura Miller. Hey, Laura. What made you spark an interest in mental health, and what is your job title?
So I'm the site director of Firelands Counseling Recovery's Port Clinton office. Firelands has 6 different offices, and I'm with the Port Clinton branch. And as a site director, I oversee administrative, but I've really been interested in mental health and behavioral health in general ever since I was a teenager, probably your age, and probably wondering a little bit about what I do as a site director. Some of it's administrative, like things like hiring, looking at budgets, oversight of some things in the building. But clinically, I also supervise like therapists, some other supervisors, case managers, and have more clinical oversight. When somebody wants to do counseling services, if they don't have an independent license, they need somebody who's independently licensed to provide that supervision. And so that's something that I do.
Wow, that's amazing.
Yeah.
So, what are some of the challenges that you have faced being in the position that you have?
Some challenges in behavioral health. Stigma, for one, is that's our topic today. Also, when I think about the clients that we see and what challenges they have, sometimes there's different financial challenges in getting treatment. And when I say that, like some insurances may not want to cover certain medications or only pay for a certain amount of treatment, and so that can be frustrating. And then the stigma piece sometimes keeps people from coming to treatment. And certainly we could talk more about that.
Yeah. And so that's actually the biggest event that has been happening around mental health is that people see stigma and they don't want to reach out. And so that's the goal of the podcast is to actually encourage people to reach out and seek help. So in your time at the Port Clinton office, what are some of the biggest changes that you have made or seen that contribute to the patients or the hospital or?
So I have the advantage that I've been in the field for a while. So I have seen a lot of actually very positive changes. And some of them being, we're talking about stigma today, but actually it has improved over time. I think about more so in the past, people would be afraid to come to the office. They didn't want to run into somebody they knew. They maybe didn't want to be seen in the lobby. That actually is getting better. I do see that. I also see that compared to the older population, younger people are more likely to seek out treatment and have less stigma about it. Now, it's not perfect. We have a long ways to go, but I've seen an improvement, through the ages that is getting better. For the field of mental health, and substance, use, because we treat both of those. For the field of mental health, there's quite a few more like evidence-based treatments. Sometimes people think of counseling or mental health being, just being nice or, chit-chatty or encouraging. But there's actually very evidence-based interventions, that therapists use. So that has increased. And there was another one I was thinking of that I wanted to tell you about. Oh, an advancement in medications. Now, I'm not a prescriber. I don't prescribe psychotropic medications. But over the years, there's been great improvements with that, and a lot less side effects for medications. And so people who might be struggling with a more severe mental illness, more like with a psychotic disorder, or even, a depression or anxiety, the medications are much better than they used to be. And so really seeing better results for people, so it's very encouraging.
So we keep talking about it, but how would you define stigma both professionally and socially?
So stigma is when you think, just putting it simply, is when you think that a certain group of people, based on, say, their mental illness, are somehow different or less than or deserve different opportunities, that they're held back because of how you perceive those people. Professionally, how professionals see a certain group of people thinking about mental health, people with mental health challenges, that maybe they would not get the care that they needed because they didn't take the person seriously. Or maybe that provider, and this could be anybody, ER doctor, family doctor, dentist, any professional, and seeing the person with mental health issues, maybe not taking them as seriously, or maybe they have difficulties because of their lack of understanding, even engaging with that person. And so their care really could be compromised if they're not getting the full benefit of the treatment. When you think professionally too, because of stigma, sometimes somebody in the workplace might be, um, because they know what the culture of the workplace is and not supporting mental health issues. Maybe if they themselves are struggling, they'd be less likely to reach out because they know that others around them, maybe think poorly upon getting treatment. So then they end up not getting the services they need.
Yeah. So, what are some the most common misconceptions around stigma? And how can stigma be the most damaging for being public stigma versus self stigma?
Misconceptions with stigma. I think that, historically, people have thought someone with mental health issues, maybe they're just not trying hard enough. You hear the phrase like, just pull up your bootstraps, or, get over it, shake it off.
Big men don't cry, stuff like that.
Yeah, don't be a wuss. All of that stuff. And somebody with mental health issues, you can't necessarily see the struggle that they're experiencing. So if somebody had a broken leg or broken arm, or, you know, um, you could see physically something is going on. But somebody could be hurting just as much inside with a mental health issue, and you not even be able to see it. Mental health issues can impact the person's functioning in their life just like a physical limitation could. And both can be treated, both can have recovery, but it's something that you necessarily can't see. Also, because most of the time, people don't know how to talk about mental health issues because it seems awkward or scary, or if somebody's struggling, you just don't know what to say, and you don't want to say the wrong thing, because you kind of feel like I don't want to make it worse. And so people just don't talk about it. And then the person might be sitting in silence and then with the stigma, afraid to reach out for help. But yeah, that misconception that someone's just not trying hard enough. And when you think about like symptoms of depression, which isn't the question, but some of the symptoms of depression are lack of energy, lack of concentration, some hopelessness, feeling sad, of course. But if you have a lack of energy and a lack of concentration, it may make you difficult to say, get your homework done, or somebody to make it to work, or to, take care of the things at home you need to take care of. And sometimes people think, oh, they're just not motivated. They don't care, and they think of that person as maybe being lazy. And that's not it at all. But they can't see that internal struggle that they're having. And if the person's not talking about it or explaining, then again, they're looked at negatively.
So when I'm scrolling through social media and you were talking about like I shouldn't be this way, how does social media impact stigma and mental health when I see an influencer with $1 trillion that's living their best life versus me who's just some guy that lives in Ohio? How does social media contribute to stigma?
Social media, it can go either way. Because there are some, famous people out there who say, hey, I'm famous, I have it all, but everybody has a story.
Mm-hmm.
And I've had to get help, and I've chosen to seek help for, whatever their mental health struggle was. So that can be a positive influence. The negative is, if they're making fun of or misjudging, was talking about social media news in general. There's also a misrepresentation that when you think about something that goes wrong, or there's something drastic that happened in the media, oh, they must have had a mental health issue, the mental health, people. but actually only 4% of violent crimes are committed by somebody with a mental health diagnosis, with a mental health issue. And so that's actually really low when you think of it.
Yeah,
It's
and
just that
broad
yeah,
generalization.
the big stories are just, out there. And so they grab our attention. But when you look at that statistic, it's really pretty low.
Yeah, it's a very small percentage of
Yes,
people.
yes.
Hmm. So, how does the effects of stigma contribute to people seeking help for their medical health concerns?
If you are feeling, sometimes people feel guilty or they self blame that they have the mental health issue because of the stigma. I shouldn't feel this way. Um, they might feel like they're not worthy of getting better. Or sometimes they feel like um, I'm the exception. I know that there's treatment out there, but I'm not capable of getting better. There's something wrong with me. And the truth is, there's actually quite a few resources, locally, for counseling and mental health help. And everybody can work a recovery. And when recovery, mental health, usually you think of substances, but mental health recovery as well, that everybody deserves to feel better, that there is
Hmm.
hope, and they should seek treatment.
So, what kind of psychological effects does internalized stigma have when I hear about that stigma?
So when I hear psychological, I think emotional, just like personal
Yeah.
self-esteem. Definitely, again, feeling like you're less than, there's something wrong with you. You might just not deserve to get better, or you, we all want to often be liked, and if you think that possibly your peers or somebody's going to judge you or think less than you because you reach out for help, then you're not probably going to do it. So, something that we can do is to talk positively. Like if somebody was struggling, like, yeah, counseling is helpful. You might want to talk to somebody about that, rather than, oh man, what,
Yeah,
what
being super
really?
negative towards it.
Yeah.
Yeah.
Ooh, I never thought you would do that. We have to remember that everybody in life has struggles. That's something that no one's immune. And sometimes people think, well, they certainly wouldn't have struggles because, they're smart and they have this and that and they have all these things going for them. But having a mental health struggle can be with anybody. Everybody has a story. And so, we're talking about impact on people, thinking about the words we use and what we say, because you never know if somebody around you might be somebody in that situation. And yeah, they're going to feel poorly about themselves and then not follow through with getting help.
Yeah. So, before you were saying about the younger generations seeking help more than the older generations, can
Mm-hmm.
you elaborate more on that, please?
So when you think about, what was going on, I mean, I can give you a little history of mental health. Like somebody who is 70, 80 years old, when you think about what was going on when they were younger. Before the 1950s, there really was not, treatment, for mental health issues. And if somebody had really severe mental health issues, it might have been more institutionalization.
Hmm.
And so, like, that's just hard to believe now because we have, such good treatment and
Many
medication. Yeah,
resources.
so
Yeah,
much
a lot of
now.
stuff.
So in their mind, that if you would talk about having a mental health issue, goodness, what's going to happen? People are going to judge me. I may not be able to get a job. I know somebody who is institutionalized. And so you just do not talk about it at all. And you certainly would keep things to yourself or in your family. You really just would keep it to yourself.
Almost kind of
Um,
suppress it.
Absolutely. Um, but over time, we are learning more and more that, and I think that this podcast will help as well, that mental health, treating your mental health is just like treating your physical health. Going to the dentist, going to the doctor, if you are struggling with your medical needs, it's the same as if you're struggling with your mental health to get help.
Mm.
And so that's something that is fairly recent. When you talked about changes in mental health over the years, that is one, where you see wellness And so when they talk about wellness, it's not just, say, maybe blood pressure and, that type of thing. They're actually starting to talk more and more about your emotional health as well. And somebody who's 60, 70, 80 for sure, they did not do that. Um, so that's where, I bet if we asked somebody who's uh, 30 or below, what is health, they may actually throw in there the mental health part, how you're feeling emotionally and how you're functioning. And that's significantly different. And when you're recognizing that treating mental health is like treating any other, struggle that you're having, then you are more likely to reach out and seek help.
Yeah, that's very interesting. What kind of barriers does stigma create within organizations or schools or hospitals or teamwork?
It's important for organizations to think about the language that they use and what their policies are. Um, I think it's good to have periodic cultural training and also some training on stigma because who said nobody's immune to have mental health issues. I think as soon as we think that, oh, I don't have any stigma, I never say anything that could be hurtful, we then that's a problem. Like we have to stay humble and be willing to examine our own beliefs. And so that's something that agencies should do as well and kind of stepping back to look at, how they portray themselves. Are they encouraging and opening to people in their organization seeking mental health issues? It's important to educate about mental health issues, and I'll give you an example of that. Um, I bet when you've gone to the doctor, because I feel the same thing happens with me, the doctors, one of their first questions, they kind of go through a depression screen.
Mm-hmm.
And that's actually fairly new. That
Really?
that
Wow.
I can't tell you when it started, but but doctors didn't necessarily have much training in mental health. And so what they found is if we educate, physicians, family doctors to start watching for signs and symptoms of mental health issues, then they're more likely to get identified and then get to the proper help that they need. But it wasn't always that way. So if we're doing that training to different professionals, and so that could be, I gave the example of doctors, but, teachers, certainly guidance counselors, principals, actually anybody in the community really could benefit from learning about mental health because they often stigmatize what they don't know.
Yes, exactly.
And if you don't know much about something, you can tend to be kind of fearful of it. And then that's where the stigma happens. So if somebody wanted to kind of examine and learn more about mental health issues, maybe they would want to like attend an event. Now this is in the past, but like last weekend in Port Clinton, we had a mental health awareness event in the community, and actually a lot of people attended. It was really
Wow,
good.
that's amazing.
Yes, we had a walk around one of the area, and I was actually very pleased the number of people that attended. But if there was something like that happening, maybe attend it, get some more information about it, because increased understanding will help break down that stigma as well.
That I have a friend that went to therapy and they hated it. It was the worst thing ever. How will that motivate me to not want to look for therapy, not want to reach out for help?
It definitely would be negative. I mean, just like if you went to a restaurant and they said, "Oh, that new restaurant's not very good," same, you would think, "Oh, I don't want to go there." But what I would do is, encourage people that a therapist, a counselor, or therapist could be a really good therapist, but it doesn't necessarily mean that they're perfect for that person. So maybe, try a different therapist. Also, if there's something that you didn't care for in that therapy session, letting the therapist know. Just like if you're going to your family doctor and they were treating you for something and you're like, oh, that didn't really work. Like, I don't know about that. I think we need to do something different. to have that communication because the therapist would know, if something was helpful or not helpful. And I will honestly say the therapist should not take it personally, really do want the feedback because the goal is for that person. And we really want them to feel empowered and in a safe place to talk about the things that they want to talk about.
When reducing stigma, what strategies are most effective to reduce or get it as low as possible to being present in our society?
One of the first ones is education, like I was saying, with really everybody, whether it's a company or, a school or, just individually, so that you have a better understanding. Because again, we tend to fear things that we don't understand. But also watching our language. It's important to think of a person, we call it person-centered language, so that if a person is struggling, with mental illness, it's a person struggling with depression. I think of more severe diagnoses like schizophrenia. Sometimes people say schizophrenic, that person's, a schizophrenic. It's like, well, no, their whole identity isn't that. It's a person with schizophrenia.
Yeah, there's actually more to them than that. They're
Yes.
much more complex.
Right. Same, like I try to give medical comparisons, a diabetic, well, a person with diabetes. You're more than just that diagnosis, or, that person's bipolar, or now a person who's, has bipolar.
Yeah.
So just watching our language that people are more than just their mental health diagnosis. It's really important. Watching negative language, because honestly, when people, I teach this one training, and one of the things we talk about is negative terms that people hear, in the community about mental health issues, things like loco or crazy or psycho. Those are very negative words. And so even if you hear somebody in a joking setting, like, oh, they're just psycho, that type of thing, you're just recognizing yourself not to use negative words and, comfortably like, oh, I think they're just, someone who's, struggling, and trying to stick away from those negative words because they perpetuate the stigma.
Mm-hmm. It keeps it rolling. The inertia from that just keeps it spiraling.
Yes. And then if somebody again overhears that and they are struggling, and you're like, oh, you're saying negative things about somebody who's struggling with mental health challenges, then again, their self-esteem, they're probably not going to follow through with getting help if they need it.
So you talked about education, and one of the main places that we have education is schools. Mm-hmm. So how can schools and teachers and staff members at the schools play a role in reducing the stigma?
I don't know if you have this at Perkins, but like teaching coping skills, as part of life skills, like recognizing that that's okay to get mental health treatment. And if somebody is struggling, that, yeah, absolutely, it's okay to get mental health treatment. I'm sure your teachers have education days. There might be times that, they
staff
have
days,
staff days that they get topics on that. You could always bring in a speaker to talk about mental health issues or have a podcast that talks about it.
That sounds familiar.
Yeah, good idea.
What role do our peers and our friends and our family play in reducing stigma?
They absolutely play a role. I mean, I think everybody does. Like, there's nobody who doesn't play a role in stigma. And education, using positive words, not judging somebody if, they talk about their mental health struggle, and just recognizing that everybody has a story. I don't know if you've heard that, like, nobody's without some challenge or struggle. And certainly, some are bigger than others. Maybe, something happened in someone's life and they're having trouble adjusting to the change, all the way up to more, severe issues. But, that peer and family, giving them support, if a peer or family member would know, like, oh, know some of the resources in the community, like, oh, did you know that there's a national hotline, 988, wherever you go, in the country, you can call 988 and talk to somebody. And then we have the local Hope line. So if somebody knows those resources, and I always encourage people to put them in the phone, because even if you don't need them, you might be with somebody who's struggling, and you can say, "Oh, did you know about this? This is a pretty cool thing. You
Hmm.
could, call this."
And they're
And
right there, like it's right in front of your face if you
yes,
ever need it.
yes. Um, so just someone to talk to, and then also they can, let you know about some resources in the community. And even if the person, your family member, didn't know about those resources, just knowing, maybe to where to reach out, like, oh, maybe the guidance counselor has some ideas of resources. And if the person was afraid to go, well, do you want me to walk down there with you? I can do that. And it's not necessarily taking responsibility for that person and their challenges, but just helping them link to the resources they need.
So, what would a stigma-free society look like to you?
It would be a society that people wouldn't be judged, by mental health issues or other struggles they were having, um, or many other things, if they were tall or short or, whatever, that they would just be seen for who they are. And it would be nice to see that one of the things we really like talk about as far as limitations with stigma is sometimes if something's stigmatized, it doesn't get like full research or funding, or people don't put time and money into increasing those resources. So in a stigma-free society, there would be um, lots of research and funding to support mental health issues.
So, circling back really quick, what are some other factors that people may not want to seek help for besides stigma?
I was just saying a little bit about funding. Sometimes people feel like it might be really costly. And actually, there are some disparities in insurance where insurance pays for medical care differently than they pay for mental health care or substance care. And so we're talking about a stigma free is that, insurance would support all, the equally, and that there would be funding for that. Other barriers to getting help are like even just having transportation time to seek help. Um, and it's interesting. I did bring a paper that I was looking at earlier today that on average people delay seeking help by 11 years. That from the onset of their mental health struggle starting to actually seeking treatment.
Wow.
And so I think sometimes people think, oh, it'll just go away, or even, oh, everybody, feels this way. I've even had people, who are struggling with suicidal thoughts say, well, everybody, has suicidal thoughts. Like, well, no, not everybody does. I mean, that's a real concern,
Hmm.
and definitely would want to seek help if it got to the point that somebody was having thoughts of harming themselves or others. That would be a definite yes. You
Yeah.
really, it's really need to follow through with that and get help. And certainly can call the hotline numbers, the 988 and the Hope line, and
Yeah.
all the other numbers that
Hmm.
are available.
So today we have been looking at lots of areas that may need some improvement in stigma. But where do you think we are making the most progress in on combating stigma?
I feel like it's in awareness, which I know stigma still exists and it's a problem, but there has been progress. And recognizing that in wellness, mental health is the same as other health. That mental health is health. And I actually have a T-shirt that says that mental health is health. And I feel like communities are talking more about it, that it's becoming, I don't want to say a buzzword, but at least in the community that I've been working in, that a lot of people are talking about that. And so, that's huge.
If you could give one message to the public about stigma and mental health, what would that be?
That you're worth it. That sometimes people think that they're not worth getting help, and everybody is worth it, and help is out there, and to put themselves out there and reach out for it, and at least get some information and be informed. Just because you say, if you're unsure, if you reached out to counseling, um, get some information, see if it's something for you. But there's a variety of professionals out there. Whether it's somebody talking to like a pastor, or, someone in, a church setting, or getting information from guidance counselor, or family doctors, do treat some mental health issues. And then, of course, the more specific, mental health counselors and psychologists, psychiatrists. But for people to know that they're worth it and that there is help out there and recovery is possible.
Wow, that is some amazing information. Laura, thank you for being on this podcast. It has been a truly amazing episode. I'm sure a lot of people have found it very interesting.
Thank you.
Thank you. Yeah. We'll see you next episode. Thank you for watching Breaking the Stigma.